So good morning everybody. We'll start today glycogen metabolism. This is important for university examination as long question. The question is put like that: describe metabolism of glycogen. Then second part, its regulation, and may be given in short note as von Gierke's disease, and many multiple choice question is possible from this chapter. So glycogen, we know by this time what is glycogen, no? What is glycogen? Tell me. Pardon? Form of glucose. This is not exactly glucose. Biochemically, you are partially correct, 10% correct. Okay. Glycogen, carbohydrate we can classify into?
Monosaccharide.
Yes. Monosaccharide, disaccharide, oligosaccharide, polysaccharide. So, glycogen is one kind of polysaccharide. How many types of polysaccharides are there? Two types. Tell me. How many types of polysaccharides are there?
Hetero and homo.
Homopolysaccharide and heteropolysaccharide. So, can you give me example of homopolysaccharide? Tell me. Homopolysaccharide. उसको क्या देख रहा है यार? हाँ? Chitin, okay? Yes, chitin is a homopolysaccharide, and I have largely written glycogen. This is also a homopolysaccharide. So, homopolysaccharide. One of the example is glycogen. It is very important. It is the stored form of glucose in animal. No? So, what does it contain? Polymers of glucose bound together by alpha-1,4 glycosidic linkage. Glycogen has branches. Okay? It is a branch polysaccharide. The branching is bond in branching site is 1,6 glycosidic bond. Okay. So its function is at the time of emergency when glucose requirement of glucose increases, it supplies glucose in the blood That means for utilization of the tissue immediately as per requirement. Okay. Thus, glycogen can maintain blood sugar in fasting state up to 18 hours. By the time of 18 hours, the glycogen content of the organ it finishes. Okay. Then comes your synthesis of glucose from the non-carbohydrate material or non-carbohydrate compounds, say protein. Okay. Then other non-carbohydrate compounds. That is called gluconeogenesis. That we will discuss afterwards. So for the future use of glucose is converted into glycogen and stored in tissue in case of animal, and at the time of need that glycogen is broken down into glucose by the process of glycogenolysis. One is glycogenesis, genesis means synthesis, and another is glycogenolysis, by which the glucose is broken down into glucose. Glycogen is broken down into glucose. So, in the branching point, it is 1,6 glycosidic bond, and in the linear chain here it is 1,4 glycosidic bond. Okay. Now, this is a diagrammatic representation of glycogen, and the red dots, these are the non-reducing end of glycogen chain. So, what is glycogenesis? This is synthesis of glycogen from the glucose. First, glucose is activated into UDP-glucose, then sequentially glycogen is synthesized. For this, ATP is required. For synthesis of glycogen, ATP is required. Now, the measures, almost all tissue can store glycogen, but major storage is in liver and muscle. About 10 gram per 100 gram of liver tissue is glycogen, and in case of muscle, it is 1 to 2 gram per 100 gram of muscle tissue. The glycogen content of liver is about 70 gram, which accounts for 280 kilocalorie of the energy, and in case of muscle, it is 250 gram per or 1000 kilocalorie of energy. Okay, the storage of glycogen in muscle is more because of more amount of muscle tissue. Muscle mass is more, so amount of glycogen also stored. Even though it is percentage in according to percentage, it is only 3% of the total glycogen storage. So, what is glycogenesis? We know synthesis of glycogen from glucose. Where it occurs? In the liver and muscle predominantly. When does it occur? So, for synthesis of glucose, we need glycogen, we need glucose, no? So, it will be possible to synthesize glycogen when abundant amount of glucose is present in the blood. That means in the postprandial state. Okay? After the food is taken, well-fed state. And in well-fed state, insulin is the hormone that takes the upper hand of activity. So, in well-fed state, glycogenesis occurs in the influence of insulin. Then, why? Because at the time of energy requirement, when there is emergency, it is the only molecule that supplies glucose for ATP generation. Yes? Anything? Why you are laughing? खड़े हो जाओ, बताओ हम क्या बताएं अभी तक. what I told. Sit down. So in well-fed state, when there is ingestion of glucose in the form of carbohydrate after digestion also, there is increased blood glucose, increased insulin release, decreased glucose or glucagon release. Remember, insulin is the only hormone that decreases blood glucose by utilizing the glucose. Okay? And all other hormones, they raises blood glucose. So when there is in well-fed state, there is increased insulin and that promotes glycogenesis, and there is decrease of glucagon which promotes glycogenolysis. So glycogenolysis is inhibited, glycogenesis is stimulated. Glycogen synthase is the enzyme which is activated by the insulin, and that causes glycogenesis. Now, how does it occur? It occurs in 4 stages of reaction. First, activation of glucose is done by forming UDP-glucose. Then synthesis of glycogen primer for initiation of glycogen synthesis. Elongation of the glycogen chain, then formation of branch chain. So what are the requirements? Glucose has to be there. UTP has to be the uridine triphosphate. Uridine triphosphate. You will know what is that uridine triphosphate. This is a like ATP, no? Nucleotide. Uridine triphosphate. We need a primer for synthesis of glycogen, that is called glycogenin. Glycogenin. We need 5 enzymes for glycogenesis to occur: glucokinase or hexokinase, then phosphoglucomutase, UDP-glucose phosphorylase, pyrophosphorylase, then glycogen synthase and branching enzyme. So these are the stages. This is the uridine triphosphate. 3 phosphates will be there. Then 2 phosphate will be removed, and a glucose 1 phosphate will be added. This green P is phosphate belongs to the glucose 1 phosphate, and red is from the UTP, uridine triphosphate. 2 phosphate will be removed as pyrophosphate. Then synthesis of glycogen occurs. First linear chain, then elongation occurs in linear chain, then branching. A portion of the glycogen is split from the main elongated chain and will be shifted to the another glucose molecule, forming a branch. Okay, so these are the steps. Glucose enters in the liver through glucose transporter 2. Glucose transporter 2. So it will enter in the glucose. The reaction occurs in the cytosol. All the enzymes of glycogen synthesis are present in cytosol. So reaction occurs in cytosol, predominantly in the liver and muscle. In other tissue also there is glycogenesis, and mainly it is liver and muscle. So it is the glucokinase which is or hexokinase which phosphorylated glucose into glucose 6-phosphate. The first step of glycolysis. No? So once glucose 6-phosphate is formed, it is converted into glucose 1-phosphate. Glucose 1-phosphate. In glycolysis, it is converted into fructose 6-phosphate. But here it will be converted into glucose 1-phosphate by the enzyme phosphoglucomutase. Okay? Phosphoglucomutase. Mutase shifts the phosphate group from 6 position to 1 position. After that, this ATP, with the help of ATP, by the enzyme UDP-glucose pyrophosphorylase. Phosphorylase always clip the phosphate group. So pyrophosphorylase means it will clip 2 phosphate group from the UTP and add this glucose phosphate in the UDP triphosphate molecule to form UDP-glucose. 2 molecules of pyrophosphate is removed and ultimately they are converted into separate 2 numbers of inorganic particles. This is a endargonic reaction, requires energy. That energy is provided by this pyrophosphate group. Pyrophosphate is high energy compound. So here now UDP-glucose is formed. Now to initiate the glycogen synthesis, either there has to be a glycogen primer. Glycogen primer consists of glycogenin plus 5 to 8 numbers of glucose molecule attached in the glycogenin. This is suppose a glycogenin. In this, 5 to 8 numbers of glucose molecule will be added. This is called glycogen primer. These are the glucose. Glycogen primer. If there is no glycogen primer, then what it is done? We have glucose 1-phosphate with the help of one enzyme called glycogen initiator synthase. Glycogen initiator synthase, the first glucose molecule is incorporated in the glycogenin. This is a protein. Glycogenin is a protein. It contains tyrosine amino acid, which contains hydroxyl group. Okay. Now in the hydroxytyrosine component residue of the glycogenin, the glucose is added in the hydroxyl group to form glycogenin with a single glucose molecule. After that, this glycogenin itself, it auto-glycosylates the first molecule of glucose to produce a chain of 8 glucose molecule attached in the glycogenin. That forms the glycogen primer. Okay, clear? Glycogen primer is a protein that contains tyrosine. Tyrosine contains hydroxyl group. Okay? An enzyme called glycogen initiator synthase will add first molecule of glucose in the hydroxyl group of tyrosine. If there is no glycogen primer exists in the tissue, then this will be synthesized newly. Then subsequently, this autoglycation occur by the glycogenin to a 6-7 numbers of glucose molecule in it to form a glycogen primer, which contains glycogenin plus 8 molecule of sugar, 5 to 8 molecule of sugar residue. Now after that comes the function of glycogen synthase. In glycogenesis, this is the most important enzyme. It is regulatory enzyme of glycogen synthesis. It is rate limiting enzyme of glycogen synthesis. Glycogen synthase, very important enzyme. Okay. So what it does, it utilizes this UDP-glucose one by one and go on elongating the glycogen chain in a linear basis. Okay, there is a linear chain of glycogenesis, linear glycogen chain. Now comes the branching enzyme, because glycogen is a branched polysaccharide. Here, this branching enzyme, what it does, it cleaves around the glycogen synthase. It adds around 11 numbers of new glucose molecule, and when the chain is long enough, the branching enzyme, it cleaves around 6-7 amino glucose molecule and attach in the another glucose molecule to form a branch. So this branching enzyme has two functions: alpha 1,4 glycosidic bond formation, cutting activity and pasting activity. Okay. So what it does alpha 1,4 glycosidase activity while removing this 6 number of glucose unit and bringing it to another glucose unit to form a side chain, forming a alpha 1,4 glycosidic bond. One is glycosidase activity and one is glycosidic bond formation activity. So both these activity is present in the same enzyme, the branching enzyme. It is the bifunctional enzyme. Okay. So there is a branch formation. Now again, glycogen synthase will come. It will elongate this one and this also. The glucose molecule is added sequentially in the non-reducing end of the glycogen chain. When it is removed for creation of branch, it will be cleaved from the non-reducing end only, not from here. Okay. So thus sequentially a branched glycogen is produced. Here is the branched glycogen. Now why branching is required? Why you need so much complex glycogen? Because glycogen, there is increased solubility of the glycogen. A compact number of large number of glucose is there. So enzyme, when at the time of emergency, can small amount of enzyme can large amount of glycogen, and large amount of glucose can be released in a short period of time to increase the blood glucose level. And this causes rapid metabolism of glycogen. Now energetics of glycogenesis. Glucose to glucose 6-phosphate, it will need 1 ATP. Then again, glycogen synthase, utilizing the UDP-glucose and producing UDP, which needs to be converted to UTP, because we need to use again and again UTP, uridine triphosphate again and again to form UDP-glucose, so that the reaction can go ahead. So to recover this UTP from UDP, we need another molecule of ATP here. So 2 molecules of ATPs are required for addition of 1 molecule of glucose in the glycogen chain. Okay? Very much energy consuming process. Now regulation. See, this glycogenesis, it synthesizes Glycogenolysis is degrades. Glycogenesis, it takes up the blood sugar and reduces it, and glycogenolysis, it aids the blood sugar in the blood and increase the blood sugar. Okay. Now, when we have taken the blood sugar is increased at the same time, glycogenolysis again putting the blood in the sugar in the blood. That means both way it is increasing. Okay, so this is not a wanted situation. So it is a highly regulated process where glycogenesis and glycogenolysis, they are controlled. Okay, once there is glycogenesis, there will not be glycogenolysis. Once there is glycogenolysis, there will not be glycogenesis. That will be decided by the state of the body, whether it is well-fed state or fasting state. Okay? Now, in the last class I told you, fasting state, the hormone glucagon will come. Its function is phosphorylation. It is a formula. And in well-fed state, it is the insulin which will function. Its function is dephosphorylation. Dephosphorylation. So this formula will be used in mechanism of action. So what it is, what it does, glycogenesis is regulated by the enzyme Glycogen Synthase. This is allosterically regulated by the glucose 6-phosphate, and it is the allosteric activator. Okay. Now, glucose 6-phosphate now, in case of covalent modification, it is regulated by the phosphorylation and dephosphorylation. When there is phosphorylation, there is decreased glycogenesis. When there is phosphorylation, there is decreased glycogenesis. When there is dephosphorylation, there is increased glycogenesis. Okay. Now, glycogen synthase, it remains active when it is in dephosphorylated state. This red thing you consider as phosphorylation. So this glycogen synthase A is not having any phosphate group here, so it is dephosphorylated state and it is active form. Okay. Now, when it is inactive, there will be dephosphorylation will be there using ATP, and it will become inactive. So how it is done? In case of fasting, the glucagon is the enzyme which works, and it works through this mechanism. It activates adenylyl cyclase, one enzyme, adenylyl cyclase. Okay. Now, adenylyl cyclase, this will form cyclic AMP by cleaving the ATP, removing pyrophosphate, it will form a cyclic AMP. Cyclic AMP, it will catalyze a reaction where inactive protein kinase enzyme will be made active protein kinase. Protein kinase. This is pKa is protein kinase. Okay. So protein kinase will be active, and this protein kinase will phosphorylase glycogen synthase A into glycogen synthase B. So in phosphorylated form, it is inactive. In fasting state, there is a need to maintain the blood glucose level. If we withdraw blood glucose more for the synthesis of glycogen, then there will be further blood sugar level will go further down. So this synthesis of glycogen is inhibited by glucagon by activating adenylyl cyclase, which converts ATP to cyclic AMP, and hormone has a mechanism of action of cyclic AMP mediated phosphorylation activation of the protein. So how it does? It activates protein kinase A, and protein kinase A will phosphorylate glycogen synthase to make it inactive. So here the glycogenesis is inhibited. Now when the food is taken, the insulin takes the upper hand in well-fed condition. It stimulates two functions. One is protein phosphatase activity, another is phosphodiesterase activity. Phosphodiesterase causes inactivation of cyclic AMP, converting it into 5' AMP. 5' AMP is not active. So it will, under the influence of insulin, cyclic AMP will be converted into 5' AMP. So activation of protein kinase A will be stopped. But we have glycogen synthase B, which is inactive. Now in well-fed state, we want glycogen to get synthesized. That means we want glycogen synthase to be active. It is done by the insulin by protein phosphatase. Protein phosphatase removes the phosphate from the glycogen synthase, thereby making it active. So protein phosphatase dephosphorylase the glycogen synthase, and glycogen synthase become active. Remember, glycogen synthase is active in dephosphorylase state. Okay. When you read, just draw it, so you will not forget, because mechanism is a bit complex. Somewhere phosphorylation is activating, somewhere dephosphorylase is activating. Like that, some confusion is there. So more you write, more you will remember. So in summary, in well-fed state, under the influence of insulin, glycogen synthase becomes active and increases glycogenesis. In fasting state, glucagon or epinephrine. Glucagon acts predominantly on the liver, epinephrine acts predominantly on the muscle, also in the liver, but predominant action is in the muscle. It causes phosphorylation of glycogen synthase. As it is in fasting state, we don't want glycogen to synthesize, so it will make the glycogen synthase inactive and glycogenesis will be inhibited. So by this way, the glycogenesis is regulated. Now, glycogenolysis, the breakdown of glycogen. The way, the steps we utilize for glycogen synthesis is not a reverse process by which the glycogenolysis occur. Okay, so glycogenolysis is not a reversal of glycogenesis. Now, glycogenolysis will produce glucose in the liver, but glucose 6-phosphate in the muscle. Short answer type question. Why not short answer type? MCQ there may be. They may give you the muscle cannot produce glucose from glycogenesis due to the absence of these 4 enzymes they will give. In that, glucose 6-phosphatase also will be there. Okay, so it is glucose 6-phosphatase is absent in muscle, so it cannot produce glucose from glycogen. It uses this glucose 6-phosphatase produced in the muscle, and it take part in the glycolysis to produce ATP substrate level phosphorylation for ATP generated by substrate level phosphorylation. So, glycogenolysis, it occurs in liver and muscle. It is also occurring in cytosol. In fasting state, predominantly in the liver, and exercising muscle, also in the exercising muscle. Glucagon acts in liver, epinephrine acts in liver and muscle. This glycogen phosphorylase is the main enzyme for glycogenolysis. This enzyme requires pyridoxal phosphate. Pyridoxal phosphate remains covalently bound with the glycogen phosphorylase. Cleaves alpha 1,4 glycosidic bond. This is a glycogen chain. So many chains will be there. So it will start cleaving the 1,4 glycosidic bond from the non-reducing end of the glycogen molecule, from here, from here. Okay, so many branch chains are there. In all the branches, it will start cleaving. It will release glucose 1-phosphate. So here we have glucose molecule, 1,4 linkage is there. It will break. We are supposed to get glucose, but we do not get, because glycogen phosphorylase, it adds 1-phosphate with the glucose and remove it from the chain. So the resultant molecule will be glucose 1-phosphate due to the cleavage of the glycogen phosphorylase. And it starts cleaving up to the 4 molecule of the branch chain. Here also, here is the branch is there with this molecule or this glucose unit. So here also it will start removing the glucose units, and it will remove up to the 4th. There will be 4 glucose units remaining. Okay, 4 glucose units remaining. This is called limit dextrine. Okay, glycogen phosphorylase causes sequential removal of the glucose 1-phosphate from the reducing end and produce limit dextrine. Now comes the debranching enzyme. Here also, debranching enzyme, it is bifunctional. It has 2 functions. It cleaves and removes the glucose molecule, leaving the glucose moiety where 1,6 bond is there. It will cleave 1,4 alpha 1,4 linkage, and it will shift to another glucose unit, and it will add here. So it causes alpha 1,4 to alpha 1,4 transferase, cleaving the alpha 1,4 bond and again forming the alpha 1,4 bond. So these 3 glucose, because these glucose and these glucose, they are forming 1,6 bond. So these 2 will be spared. Here it will break, and these 3 glucose will be brought here in the another chain, and they will form a alpha 1,4 linkage. So one glucose unit is there, which is forming the 1,4 linkage in branch side, and other 3 are brought in the long chain. So now the glycogen phosphorylase will continue again from the non-reducing end, and here the debranching enzyme, it will remove this 1,6 glycosidic bond by glycosidase activity, and there will be removal of 1 free glucose. Okay, so we are getting on hydrolysis of glycogen, we are getting glucose 1-phosphate plus free glucose in a ratio of 8:1. 8:1. So after removing this, it has become a debranched glycogen chain. Then again, it will be acted upon by glycogen phosphorylase. Now, we are having glucose 1-phosphate. The glucose, free glucose we have received, it will take part in glycolysis, or it will go undergo further metabolism. Then, in case of glucose 1-phosphate, what it is done? Glucose 6-phosphate is synthesized by the action of phosphoglucomutase, shifting the phosphate group from first carbon to 6th carbon. Now, in the liver, this glucose 6-phosphate enters in the endoplasmic reticulum through glucose 6-phosphate translocase. This is a protein, translocator protein. This is glucose 6-phosphate translocase in the endoplasmic reticulum of hepatocytes. So it will be brought into the endoplasmic reticulum, and there will be phosphatase activity, glucose 6-phosphatase, an important enzyme. Glucophosphate remove glucose, this phosphate group from the glucose 6-phosphate, and free glucose is produced. This will diffuse out from the endoplasmic reticulum and serve the necessary metabolic function. Means it will raise blood sugar to normal. Okay? In case of muscle, this glucose 6-phosphatase is not there. That's why it cannot produce glucose from the glucose 6-phosphate. So this glucose 6-phosphate will be diverted for glycolysis, where anaerobic substrate level phosphorylation can take place, so that ATP is generated on emergency basis. Now another form of glucose degradation is there, glycogen degradation. It is the acid maltase present in lysosome. Lysosome also can hydrolyze very less amount of glycogen by action of acid maltase, alpha 1,4 glycosidase. Okay. Now, this is important because there is a disease called Pompe's disease that occurs due to deficiency of lysosomal acid maltase or lysosomal glucosidase. Now, here is the regulation of glycogenolysis. So, there should not be glycogenesis and glycogenolysis at the same time. Here, the main enzyme is glycogen phosphorylase. Glycogen phosphorylase. So glucose, when it's abundantly present, or ATP, when it is abundantly present, or glucose 6-phosphate, when it is abundantly present, will inhibit both muscle liver and muscle phosphorylase. Glucose inhibit the hepatic phosphorylation, and ATP, glucose 6-phosphate, inhibit the muscle phosphorylase. Why? Because glucose is not produced in the muscle by the process of glycogenolysis. So, glucose will inhibit the hepatic phosphorylase. However, ATP and glucose, these will produce causes both hepatic and muscle phosphorylase, glycogen phosphorylase. Cyclic IMP, it will activate muscle glycogen phosphorylase, because when there is abundant number of AMP, it indicates that there is ATP inadequacy. ATP is hydrolyzed into AMP by removing pyrophosphate. So, repeated use of pyrophosphate or ATP may cause increase cyclic AMP level, and then it will activate this muscle glycogen phosphorylase, so that there can be glycogenolysis. And when there is decreased sugar, when there is decreased glucose in the blood, this will activate hepatic glycogen phosphorylase, so that liver glycogen phosphorylase can take glycogenolysis, and there is increased glucose. Now, glycogen phosphorylase, it is regulated by allosteric regulation, what I have now discussed now, and hormonal regulation by covalent modification. Now, in case of phosphorylase, this glycogen phosphorylase, it is active when phosphorylated and inactive when dephosphorylated. In glycogen synthase, it was active when dephosphorylated, it was inactive when phosphorylated. Just opposite. Protein kinase will phosphorylate this also, the glycogen synthase also. So, glycogen synthase will be inactivated, but phosphorylation of this glycogen phosphorylase will make it active. So, when one become active, another become inactive. Okay? So, glucagon, it will cause phosphorylation mediated by the cyclic AMP, and it will glycogenolysis will be stimulated. Insulin in well-fed state, it will cause dephosphorylation, and glycogenolysis will be not favored. This is the mechanism what we have discussed in the glycogen, same as that of this one, but here glycogen phosphorylase is inactive when not phosphorylated, and when phosphorylated it becomes active. So, here you see glycogen phosphorylase is active when phosphorylated. Inactive when dephosphorylated. Now here what happens? Protein kinase, it activates glycogen phosphorylase kinase. This is not the glycogen phosphorylase enzyme. This is glycogen phosphorylase kinase. This will again phosphorylate the glycogen phosphorylase. So it will be activated by the protein kinase, and on phosphorylation, this glycogen phosphorylase kinase will be activated. This again will cause phosphorylation of glycogen phosphorylase B, means inactive form, into glycogen phosphorylase active form. So there will be glycogenolysis. But in case of well-fed state, insulin will cause protein phosphatase 1. Protein phosphatase will be activated by insulin. So there will be dephosphorylation of the glycogen phosphorylase. It will become inactive. So once it is inactive, this will not be activated anymore. And whatever glycogen phosphorylase has been activated, that will be dephosphorylated by the protein phosphatase 1. Protein phosphatase here also, this will dephosphorylated. This also will become inactive, and here it also become inactive. So insulin will cause glycogen, it will stop glycogenolysis, so that there should not be any further decline of blood sugar. Insulin inactivates, so glycogenolysis will be stopped, so that there should not be further increase of blood sugar. Because in well-fed state, there is already high blood sugar, insulin is functioning. Now, again, the glycogenolysis is also activated by the calcium and AMP. On muscle contraction, when nerve impulse is generated, it causes membrane depolarization, and that causes release of calcium. Now, this calcium, it binds the calmodulin. Normally, this calmodulin remains bound to the glycogen phosphorylase kinase B, making it inactive. Okay? Now, when calcium is released, the calcium will bind, 4 molecules of calcium will bind with the calmodulin, releasing the glycogen phosphorylase kinase in active form. So, glycogen phosphorylase kinase will phosphorylase glycogen phosphorylase B into glycogen phosphorylase A, means active, and there will be glycogenolysis. Glycogenolysis will be favored. During the muscle contraction, we need glucose in the muscle, so glycogenolysis will be activated. AMP in the muscle, it will stimulate this glycogen phosphorylase B. It will cause glycogen, stimulate the glycogen phosphorylase B into glycogen phosphorylase A. It will activate. So there will be more glucose 6-phosphate. More glucose 6-phosphate can take part in the glycogen synthesis, so more ATP is formed. So, in well-fed state, glycogen synthase become active. There is glycogenesis, so there is glycogen synthesis. In case of fasting, glucagon becomes, epinephrine becomes active. Glycogen phosphorylase will be activated. There will be glycogenolysis, so glycogen will be glycogenolysis will be activated, and there will be rise of glucose level to maintain normal blood glucose. Glycogen storage disease, so many glycogen storage diseases are there. So, here I told glucose 6-phosphatase in the endoplasmic reticulum. This is the most important enzyme. Deficiency of this enzyme causes von Gierke disease, type 1 von Gierke disease, type 1A von Gierke disease. Now, transporter, this is the enzyme commission number 7. No? Enzyme commission, that class 7, the glucose, it is a translocase enzyme. So, when this enzyme is deficient, glucose 6-phosphate cannot come here. That will cause glucose 6-phosphate again inhibit this glycogenesis, glycogenolysis. So, there will be deposition of glycogen. So this will cause type 1b von Gierke disease. So likewise, in Pompe's disease, there is lysosomal acid maltase deficiency. In Glycogen Phosphorylase deficiency, in the muscle it will be McArdle syndrome, in the liver it will be Hirsch disease. Then in case of debranching enzyme, limit dextrosis, which limit dextron will be deposited in the tissue, that is called 4B's or 4E's disease. So many glycogen metabolism disorders are there, around 11 numbers of disorders are there, but for you, this is very important. Type 1A, von Gierke disease. These are the 10, one more is there, 11 is there. So, this you will remember, you have to learn this one. These are the diseases, it is from the Chaitanya. Their characteristics have a look, we will proceed to the next. So, you may be given a case study. You see, case study means previously they used to give a case study like that, then from their descriptive questions they used to ask. Okay, but nowadays it is been, it may not be given like that, it is changed. So, von Gierke disease may be given as short note or may be given as case like that, and in the below there will be MCQ. Okay, so this is because of the, now it is like that, 1 year old female child, progressive abdominal distension, vomiting and lethargy for 2 months. There was no history of seizure or recurrent infection. There is growth is slightly delayed. Then history of death of cousin during infancy due to the liver disease. So it is one clue, liver disease. Because von Gierke disease, there will be deposition of glycogen in the liver. So there will be liver disease. So they don't know, they call the liver disease se mar gaya. Because this is a genetic disorder, autosomal recessive disorder. So on examination, doctor found that she is having doll's eye, face, fatty cheek is another this one clue, and protuberant abdomen due to the hepatomegaly, massive and firm hepatomegaly is there. Kidneys are palpable. There is deposition of glycogen in the kidneys also. So when you palpate, you can find kidney also. But spleen is not palpable. Spleen is not palpable. Okay? Spleen is not palpable. If there is no deposition of glycogen in the spleen, when spleen is palpable, then again you think something else. Spleen, there may be leukemia, there may be chronic malaria, there may be some other disease. Okay? Then on examination it is found low blood glucose level. There is glycogen, the phosphatase is deficient, glucose 6-phosphatase is deficient. So there will be accumulation of glucose 6-phosphate, accumulation of glycogen. So once there is 6-phosphatase deficiency, it cannot go for glycolysis. No? So glucose is not, the free glucose is not released in the blood. So there will be fasting hypoglycemia. High lactic acid, hyperlipidemia, hyperuricemia, all are the clues. There is mild elevation of liver enzyme. Liver function is moderately altered. ABG analysis, high anion gap metabolic acidosis because of the lactic acid acidosis. Urine Benedict test negative. Okay. Then on liver biopsy, hepatocytes contain greater than normal amount of glycogen. Okay. Now, why it happens? In glucose 6-phosphatase, it cannot get converted into glucose. So, there is fasting hypoglycemia. There is increased level of glucose 6-phosphate. This glucose 6-phosphate is diverted to another way, HMP shunt, hexose monophosphate shunt, that causes increased ribose 5-phosphate synthesis. This is required for the, क्या हो गया? This is required for the synthesis of nucleotide. So there will be increased purine synthesis because of the activation of PRPP, phosphoribosylate pyrophosphate activation. One enzyme is there, phosphoribosyl pyrophosphate. This we will get after a few days when we teach you this synthesis of nucleotide. So that will cause increased purine synthesis. There will be increased degradation of purine, and that will cause rise in uric acid. Okay, so there will be hyperuricemia or gout. Then metabolic acidosis due to the lactic acidosis, hyperuricemia will be there, hyperlipidemia. Now, this low blood glucose level will stimulate the alternate source of glucose that will activate the hydrolysis of triacylglycerol. Triacylglycerol will release free fatty acid. Free fatty acid beta oxidation will increase acetyl-CoA. Then again acetyl-CoA, it cannot come to the glycolytic TCA cycle. It will divert it to form cholesterol and keto acid. Okay, and this one cholesterol will be there, so there will be hyperlipidemia. Hepatomegaly will be due to the deposition of glycogen. Which other investigations can be done? See here, free fatty acid will cause ketone body formation that will lead to ketosis, and there will be increased cholesterol synthesis. Okay. There is no specific treatment. Further investigation, we can scan liver for any liver disease. We can analyze genetic analysis of liver enzyme deficiency. We can do that. And treatment, there is no treatment specific. There is raw cornstarch may be given as infusion at night, so that there is no fasting hypoglycemia. Avoid fructose and galactose. Limited intake of lipid to be done, because otherwise, as such, there is hyperlipidemia is there. So, bone-gear disease, glucose deficiency. In summary, it affects liver, kidney, fatty liver. There will be fatty liver. Hepato and renomegaly will be there. Progressive renal disease is there. Then growth retardation will be there. Delayed puberty. Then normal glycogen structure or increased normal glycogen structure. The glycogen stored in the liver will be of normal structure. Okay. So here muscle is not affected. Fasting hypoglycemia is very severe. Hyperlactic acidemia, hyperlipidemia, hyperuricemia. These are the some of the manifestations. Then nocturnal gastric infusion of glucose or regular administration of uncooked cornstarch. So this is the today's lecture.